just now. Table 3. How do I know that I'm looking at the anterior cord or the posterior cord? Spinal artery. Anterior spinal artery. Good. And you can just look and you see it nicely running along here. Right. About how many nerves come off the spinal cord? 31. Round. I didn't hear pairs. 31 pairs. Good. Good. 31 pairs. Alright. So about 8, 12, 5, 5, 1. 8, 12, 5, 5, 1. Sorry. See? Well, what happened is that the spinal accessory would have some branches, but it is as if those C1, C2, C3, C4, it would be like cervical branches. In other words, imagine the C1, C2, C3 as being shared with the spinal accessory. Yeah. Now, how many denticulated ligaments do I have? How many denticulated ligaments do I have? 19 to 22. Pairs. Pairs. Alright. Okay. Now, I'm going to put the tip of my rod underneath a point there. You can see that it probably doesn't look much like a little triangle to you, but what I try to do is to put it underneath that denticulated ligament. Okay? So what will happen is that the higher will leave the cord and go laterally. It will surround the anterior rootlets and the posterior rootlets. So look, the two sets of rootlets going west. They're going laterally, and under them or around them is going to be the denticulated. You can see a little gray thing under the side, Giovanni. You see a little gray thing on the side. Put the thin. It's very thin. You see it there? Yeah, that is the denticulated ligament. Right. Now, if you look here, I have more than one nerve here. I have 1, 2, 3. At least I can count here. So what do you call these? What are these things that my pointer is going under? Rootlets. Rootlets. So when you talk about a cervical root, it's not just one nerve. Nerves are coming together to form the root. Okay, so it's rootlets. So look at the spinal cord. Let me see if you can get a better appreciation. You see, good. You can see several. 1, 2, 3, 4, 5, 6. Maybe about 6 there. You get it? All of those now, they're leaving a segment of the cord. So when we say a C1 segment or a C2 segment or a C3, it's a bunch of nerves we're talking about. Leaving the segment of the spinal cord and going west. Anterior root, posterior rootlets. Anterior rootlets, posterior rootlets joining together and forming one nerve. You get me? The anterior rootlet is going to have mostly motor fibers, and the posterior rootlet is going to have sensory fibers, and they're going to join together. And then after they join, they can distribute. So when a nerve is running around the trunk, running around as an intercostal nerve, it is not a plain sensory nerve. It has motor fibers in it and sensory fibers in it. So you can pick up, send the signal in, and you can output through the motor aspect of it. Okay? And it go ahead, Ralph. Go ahead.
The anterior rootlet is not purely motor.
Yes, traditionally, the anterior rootlet is motor, classic. That's classical teaching, and the posterior root is sensory. But it has been found that people have cuts. For example, anterior rootlet, and in a way as to block a particular sensation or block something. And what they have found is that there are sensory nerves that sometimes are going through these rootlets. Okay, but I don't want you to know the fine detail and forget the major part. The more important thing for you to know, take away, and this is just your first 6 weeks of neuroanatomy. Okay? Is that the anterior nerves are motor nerves, okay? And the posterior are sensory. That's the classical teaching. You cannot not know that. Alright? What I mentioned just now is just a little extra. For those who are going for their first class. Alright. Okay. Now, about how long is the spinal cord? About 18 inches, so about 45 centimeters in a male and about 42 in a female. And the end of it, where will it terminate? The cord, spinal cord, around T12L1. Okay? Now, in an elderly person, you expect it to terminate at T12L1? Where you might find it? Down at L3, but how it reach down so far? Why might it reach down so far in an elderly person? What is shrinking? The disc, right? The discs can shrink. The disc, remember, has a tough annulus fibrosus and a soft jelly in the center. Nucleus pulposus. Sometimes there's cracking of the fibrous annulus fibrosus and jelly can leak out through the cracks. And so you can get a kind of a compression or craniocaudal shortening, and therefore the cord might reach down to L3 in an elderly. It's important that you remember that, because you might have elderly patients who come in for surgery might be good enough for a general anesthetic. They have serious heart issues and respiratory problems. But we could just take 5 cc's lignocaine with some adrenaline and some glucose and drop it in the lumbar sac and deaden the whole lower limb and operate. Okay? But you want to recognize that the cord can be low, L3. So when you put in your needle, you have to bear that in mind, because you don't want to stick the needle in the cord, inject anesthetic in the cord, and then the man has a permanent injury because he went to this great doctor and ended up paralyzed. Okay? So you remember that in an elderly person, the cord can be lower than the classical position of L1. So in your age group, we expect it going to be at T12 L1. It's going to be 212 L1. No, listen. In the anatomy, if you said L1, L2, that's fine. But remember, it's anatomy. So you're going to find some cords at T12 L1, some going to be L1, L2. Okay? As a matter of fact, some will be lower than the classical, you get me? Because everybody not the same. Alright, but in the older person, it can be lower than normal. You want to bear that in mind. Also in the child, the newborn, about what level you expected? At L3, you see? So, you remember that when you have to do a L lumbar puncture for a little baby. Alright, what we call all this stuff going down here like horsetail? Good name, Corda and equinus horse. So, Corda equina is a proper name for this horsetail that we have here. I was looking here for the, what do you think I'm looking for? The what? Stylum termina, yes, stylum termina. I think I have it here. It has seen better days. It has seen better days. It's yes, alright. Okay. Alright, let's go upstairs and get some other sections. Sure. Of the spinal cord? Alright, well, maybe you talk too fast. Maybe you talk too fast. We can show on this. So right here, we have a cross section. Use the other camera, see if we can make that do that. We use another camera so we can look at it better.